versus SMILE. And I think we can all agree that there's more to a refractive error than sphere and cylinder. To my best knowledge, sphere and cylinder is the limit of what we can do with SMILE. And if we look at the progress that we have achieved with Femto-LASIK in the past 10 or 15 years, there's a significant step towards customization and individualization. We can prevent the induction of spherical aberration. We can form the spherical aberration of the eye in such a way that the depth of focus can be increased. Actually, I myself have had a blended monovision LASIK, Femto-LASIK on my eyes, and as you can see, I can perfectly read without glasses. So additionally, we can use topo-guided ablation profiles in order to correct higher order aberrations. And the FDA results of the latest Contura development show that we can go beyond perfect vision. Almost 35% of the patients could see better than 2012.5. And this is an FDA multi-center study result. So this is not fake. Now, laser tissue interaction matters when it comes to deal with higher order aberration. And you have to remember that the Excimer laser is used as a resolution of 0.2 micrometer per ablation rate. And that's an order of magnitude less than what we can achieve with a femtosecond laser. Both lasers have their perfect indications and they do what we expect from them. But when it comes to higher order aberration and a submicron range of modification of the cornea, I think the Excimer laser is just still the instrument to work with. Now, why not SMILE? I'm an early adopter, and I think when SMILE started, there was inflated expectations with regard to this new technology. And in the moment, we are in a trough of disillusionment. We'll see if this technology will come back or will come and take over kind of enlightenment and take a majority of the treatments. This is an open question yet. I think there's a lot in terms of technology that has to happen in order to achieve this. For the time being, I think the reason why I did not adopt to SMILE is, for example, the recovery after the procedure is slow as far as I can see in the literature, but also from the saying of the patients that I've met and also from colleagues who are working with SMILE. Now, what is the reason for this? Could it be that the flapless procedure is nice in terms of concept, but it causes some sort of mess in the cap because the cap doesn't really suit the bed anymore. And we observe that there are distinct micro distortions in the flap, and that could interfere with the clarity of the visual acuity. Now, it is said that SMILE is a safer procedure in terms of prevention of ectasia, and this is just not true. We have seen cases of ectasia. Actually, these cases, the first cases that were reported, they came from Egypt, nicely reported cases in the Journal of Cataract and Refractive Surgery. And we all have to remember that the normal corneal topography comes up to 1 of 3 cases in ectasia. If you touch the cornea by ablation, then or by resection, you can just cause ectasia, and that's a fact, regardless of the procedure that we are working with. So, as a matter of fact, it is such that with regard to the consumption of tissue, we know that we have a higher tissue consumption for SMILE compared to LASIK for the same given ametropia. And additionally, SMILE is not a procedure that is free of complications. Actually, there are many complications that can happen. Epithelial ingrowth is just one example. Incomplete resection of the tissue is another example. And altogether, there's a very flat learning curve. And you have to do 100, 200, 300 cases in order to really be a professional and a good surgeon with regard to SMILE. So the question is, how many advantages does SMILE give to the surgeon that you encounter this price that you pay for it by complicating eyes that you can easily treat with PRK or LASIK? And finally, Another weak point of the SMILE procedure is that the retreatment options are limited. You need to have an Excimer laser anyway. You can do a flap cut on the cap, but then you have a very thick flap, or you can do a PRK on top. So in any way, you need to have an Excimer laser. And not to use the Excimer laser for ablation just because you have SMILE, I think this is kind of irritating to me. So one argument that we very often hear is that LASIK causes dry eye and that SMILE does not cause dry eye as much, but this is myth. We all know that after 3 months, 6 months, patients who suffer from dry eye, they come back to normal. And if a patient had dry eye before the procedure, he will have dry eye after the procedure as well. That's quite normal, but that's the same with SMILE, I believe. So in summary, I think I do not see a single indication where SMILE could possibly perform better than Femto-LASIK. And if I doubt to perform a Femto-LASIK, I still have trans-epi-PRK and also there are phakic IOR. So if I still have doubt, I just don't do refractive surgery. So this is my position with regard to LASIK compared to Femto-LASIK, to SMILE. Thank you very much.